Once again, I'm Dwayne Winter. I'm with the Brotherhood. So because of the COVID pandemic, what we're going to be doing is these socially determined health talks. And this is the first of many to come. And primarily the talks were centered for the Men's Health League around just men's issues. But we want to start a forum where women are involved too. And you'll see women on the Zoom talk tonight too. And the more people that come to this stuff, it's just better for the community and better for our outcomes as we move forward through this pandemic. So any questions for me before I introduce our speaker? Marsha, you got something to say?
You do always pick on her, though.
Yes, I got to.
I'm looking forward to hearing
I got to pick on her.
That's right. I'm looking forward to hearing the speaker.
All right. So, so I'm going to introduce you guys to Dekota Clayton. He is an audiologist. He is probably I guess the only Black audiologist in Halifax. Am I correct saying that, Clayton?
You are. Actually, there's probably only about 10 of us in Canada, so yeah.
Yeah. So he's a territory manager and Atlantic audiologist for Starkey Laboratories. And so he's going to give us his talk about audiology and how it affects health and other determinants. So it's going to be informative as well as informal in the fact that we want as many questions you ask. So Clayton, go right ahead and enjoy your talk.
Perfect. Thanks for having me. I see Archie's comment and I agree. And those of you who do not have your mics muted, can you mute your mic so that there's not much interference? And just to streamline the flow, when I like to do these sessions for questions, would you mind typing them in the chat box and then I can just see them as they come in, answer them as I'm going, or I can answer all of them at the end just to keep things flowing nicely. So let me share my screen. And again, I want to thank you all for taking some time out of your evening. And thanks for that intro, Dwayne. All right, so, all right, can everybody see my screen now? Yep, perfect. Okay, so I'm gonna cover tonight the importance of hearing on your overall quality of life, okay? So I have a pretty big agenda, okay? I'll give you guys a little bit more information about myself. What is an audiologist? Some of you may know or some of you may not know, so I'll just define what an audiologist does. I'll talk about some Canadian statistics. I'll review the anatomy of the ear, which all we see is the outside part, but there's actually more to it than just what we see with our eye. I'll talk about the conditions that are relevant that are associated with hearing loss. Loudness levels. So, you know, we all know that things are loud. We live in a very noisy world, but what levels are safe and what can you do to, you know, protect yourself? A big one, I think, will be some signs and red flags of hearing loss. I'll then talk about how to protect your hearing. And I have a challenge for all of you that I'll get into. Then I'll just review what you would expect at a hearing assessment and close with a little summary, okay? So a little bit about myself. So I do know a few of you on the call. I was born and raised in Halifax, actually grew up in Uniacke Square, okay? Dekota Clayton, so I come from a very large family, Clayton, Lopi, Wright, you know, Adams, and I'm actually the youngest of 8, so I have 7 other siblings. Archie, I know you know a few of my older brothers for sure. So in 2010, I obtained a double major in psychology and sociology from Dow, and then I furthered my studies and I obtained my master's of audiology from Dalhousie in 2013. So as Dwayne mentioned, since graduating, I've been working for Starkey Hearing Technologies, and we are a manufacturer of hearing devices, hearing equipment, hearing aid batteries, and everything to support somebody who needs hearing help. I'm an active member of the National Association, which is the Speech and Audiology Association of Canada, and I'm a registered member of the Nova Scotia College of Audiologists and Speech Language Pathologists. So let me jump in here. What is an audiologist? As I mentioned, some of you may or may not know, but we're specialists and we're trained to identify hearing loss and balance disorders, okay? So we can diagnose a hearing loss, we can provide the rehabilitation, we can work with you through the different phases of your hearing journey, as I like to call it. We also advocate to prevent these disorders. Hearing is an invisible handicap. Most people don't know that their hearing is going until it's too late, and then they need to intervene with a hearing aid. So the best method to preserve it is prevention. Okay, so I'll talk highly on that. And in Nova Scotia, audiologists mainly work in two settings. One is a public setting, and some of you may or may not have been to like a Nova Scotia Hearing and Speech Center. There's about 20 or so across the province. Some deal with speech only, others deal with hearing. And then there's about 50 private audiology clinics that are run by individuals that are the owners within the province as well. And in most provinces, you must be licensed to practice audiology. Is that a question? Okay. So, some Canadian statistics. So the incidence of hearing loss is quite high. So 1 in 4 Canadians report having some degree of hearing loss. Okay, so 25%. So doesn't mean that, 4 out of the 16 people on the call have it. It's just an average, okay? But what's astounding is hearing loss is the 3rd most prevalent chronic condition in the world and is one of the most widespread disabilities, okay? It's inevitable. We're all going to get older, and aging, which is known as presbycusis, it's the #1 cause of hearing loss. So, I don't know who's the oldest on the call, but it's more than likely that there's probably some degree of hearing loss starting to happen. It just happens with age. Inside your ear, the hair cells start to just break down, and you can't repair them, okay? Also, in babies, okay? So 1 in 1,000 babies are born with hearing loss, or they'll go on to develop hearing loss in childhood. What's great though is that in Canada, we have a universal newborn hearing screening program, okay? That means with Nova Scotia Hearing and Speech, once you have a baby, within 24 hours, they want to come to your room, put a little probe in the baby's ear, and they want to check the baby's hearing on the spot. If there is a hearing loss, that can allow us to provide early intervention for best possible outcomes. Okay, so this is universal across Canada. Now, some families choose to opt out, and that's their personal choice, okay? So let me review the anatomy of the ear. And I want to mention I cannot see the chat box for some reason. So I don't know if there's questions coming through or not, but I can't see the chat box. Okay, now I can. I figured it out. All right, so the anatomy of the ear. When we look at the ear, we like to look at the ear in 3 parts. The outer ear, the middle ear, and the inner ear. So I'll talk about all 3 parts. So what we see primarily is the outer ear, okay? We see our pinna, this is the physical ear, and we also see the ear canal. This is where everybody likes to stick Q-tips, right? They stick them down here. Hopefully they hope that is clearing some wax up, but I'll talk about Q-tips a little bit later. So the goal of the outer ear here is to actually gather sound and funnel it down so that it hits your tympanic membrane or your eardrum, okay? As I mentioned, those Q-tips, if you stick a Q-tip in too far, and I'll talk about those later, you can actually puncture your eardrum. And I'll tell you, you'll be in some excruciating pain, okay? So the outer ear, let's gather sound, funnel it down so that it hits off the eardrum. Once it hits the eardrum, okay, it actually causes a little bit of vibration here, whereby we have the 3 smallest bones in the body. These are one of the only bones, or 3 only bones in the body that when you're born, they're the same size forever. Okay, so it's called the hammer, the incus, and the stapes. Okay, so you can see this one here looks like a little stapes, okay, like a little horseshoe. And these are responsible for getting sound to our hearing organ, which I'll talk about. Also in your middle ear, you have your eustachian tube. So your eustachian tube, this is responsible for keeping the pressure inside your middle ear here the same as the outside world. So an example I like to give is an airplane, right? I'm sure most people have been on an airplane. When you go flying on an airplane, what happens when you take off and you get up high? You need to start swallowing. When you swallow, it's actually opening your eustachian tube to let air in so that it equalizes the pressure so that you're not like this on the airplane the whole time, okay? So the eustachian tube is very important, and this will come into play a little bit later when I talk about ear infections as well. So now we're going to go to the inner ear, okay? So the inner ear, this is where all the magic happens. So once we gather the sound, there's 2 important things that happen in the inner ear. In the inner ear is a very closed system, very hard to get to, and it's very protected from a lot of things. So within your ear, yes, there's hearing, which is your cochlea, okay? So they call this the little snail. It looks like a snail shape. But also we have our balance. So these are 3 little canals, okay, that are important in your balance. They're on different planes, and they make sure that you know where you are in space, as well as, you know, make sure that you're in an upright position. So I'll talk about all of this in more detail. So sound comes in through the ear canal, hits the eardrum, causes a vibration here, and this actually pushes fluid into, changes the pressure in the cochlea here, and this is your nerve that then runs up to the brain, okay? So we hear from sound waves, but we make sense of it up in our auditory cortex with our brain. Okay, maybe I should stop there and see if anybody has any questions.
And I want to know explain to me what profound hearing loss means.
Absolutely. So I do have a slide on that, but a profound hearing loss means that you have, if I can put it in a percentage to keep it simple, you have about less than 10% hearing left. So 90% is gone.
Can you get it back?
You cannot get it back. Hearing does not regenerate. You cannot regenerate hair cells. After a profound hearing loss, it would be, you know, they tried to amplify you with a hearing aid first, but that's only one part, which is the hearing loss. We communicate with speech, and that's the other part. So if their speech and their ability to understand is not good, after a profound hearing loss, people are cochlear implant candidates, and that's when they get the surgery done to implant an electrode into their cochlea.
Okay, I have a question. How do you measure the percentage of loss of your hearing?
So it's done on an audiogram. So I have, towards the end of the presentation, I will walk through what is captured on an audiogram, and then there's different levels: mild, a moderate severe, and then a profound hearing loss. It's based on the levels that you associate sound with. Okay, I have quite a few questions coming in here. So how would you determine if a baby has hearing loss? What are the signs? Great question, Archie. So with a baby, we use, because the baby can't really talk to you, they can't push any buttons or anything like adults do. So we actually have a device called an OAE, so an otoacoustic emission device. It's a little machine, and what it does, it actually puts a sound in the ear, but within the little probe tip, it actually has a microphone. So the ear it can actually make replications of what's going into it. So for a baby, we put a sound in the baby's ear, and then the microphone on that same probe actually picks up on sound that the ear is playing back into the microphone. It's pretty amazing, actually. A sign as well for a baby would be, they're not responding. They don't startle. You drop something on the floor, there's none of the startle reflex. Okay, they're just kind of in their own little world. And I'll talk more about babies when it comes to ear infections. Can you speak about the correct way to clean your ears? Yes, not with a Q-tip. Okay, the run-in joke in audiology is that you do not put anything in your ear bigger than your elbow. Okay, so the correct way to actually clean your ears is do nothing. The ear is actually self-cleaning, meaning it will clean itself. What you do when you clean with a Q-tip, you actually push the wax. If I go back to my little slide here, if you use a Q-tip, and wax is actually made right here, okay, so you can see this is a softer portion and this is kind of a bony portion. So wax is made right about here, and then it works its way out. When you stick a Q-tip or anything in your ear, you actually drive the wax back, and it actually makes it harder to actually come out on its own. Okay. So I have a couple more questions. Just 1 second here. I just got to get my chat box back up. Okay. What causes ear infection? So I have a whole slide on that. Okay. And I'll talk about ear infections for you, Karen. And Q-tips feel so good, though. Can't wait till you touch the danger of using them. They do feel good. The ear is very sensitive, and a lot of people like to just put them there and maybe move them around, and they'll roll their eyes back. It's that sensation. But I know if I were to ask you, do you use Q-tips, and you tell me no, I look in your ear with my light and I can see all the particles of the Q-tip stuck to wax. Do we start producing more earwax as we get older? Earwax is like sweat, okay? It's produced by one of your glands in your ear, okay? And it's very individualized. So for myself, I have one ear that gets clogged probably once every 6 months. The other one's fine. Another person, they may never have an issue with clogged ears or their ears being full of wax, whereas others, they produce an abundance of wax. It's very variable. Another question here, Michael. After you shower, what is the best way to dry your ear? Great question. So water is not harmful to the ear, okay? The only time water can potentially damage your ear is if it's super cold water or super hot. As I mentioned earlier, balance is in the ear as well. And if the water is too cold, it can actually do one of two things. It can actually cause you to cause your eyes to start having some nystagmus or rapid eye movement because it's engaging your balance system. Or people that are cold water swimmers, like scuba divers, too much cold water in their ear can actually cause bony growths to happen, okay? And they don't hurt. The danger of water would be if you had the water and if it was infected or something like that, then you have a risk of getting an infection. I have eczema in my ear. What is the best thing to use besides drops? Okay. So I'm not sure, Archie, but there's some drops out there called Miracell. I don't know if you've heard of those, but Miracell are for really dry, itchy ears, and they actually provide moisture and rehydrate your ear canal. Okay, so Miracell, you could pick those up at any private clinic, and they should help with the eczema portion. I'll talk about that in a little bit as well. Eczema comes up in a few other slides. Sometimes when I chew, my ear pops. Is chewing gum harmful in any way? So the reason why your ear's popping, you could have, it could be one of two things. Oh, one of two things. One could be you have a TMJ issue, which is your temporal mandibular joint. So if you take your finger and put it here and chew, you'll feel movement there. And what that is actually, the floor of your mouth is actually, sorry, the roof of your mouth is the floor of your ear canal. So sometimes when you chew, you hear that popping sound. That could be your TMJ, okay, which is an actual temporal mandibular joint, a little syndrome there that you might need to get looked at. Or it could be eustachian tube related. And that would mean you could be getting off of a cold, meaning that, you know, the pressure is just not right inside your middle ear. As I talked about, the eustachian tube makes things equal between the middle ear and the outer ear. And if you have a cold, you know that your ear often gets plugged up and you feel like you can't hear. That's your eustachian tube, and then you get that cracking sensation. Chewing gum is not harmful. It will not do anything. And in fact, it might help if it's an eustachian tube problem. Some great questions. Is it okay to carry on now? Yeah? Okay. So now I'm going to talk about some conditions that are associated with hearing loss. So I've already talked a little bit about our balance system, okay? So I'll just abbreviate this to BPPV, okay? And this is one of the most common types of vertigo where certain changes in head position can cause dizziness or a sudden spinning sensation. You guys may know somebody who tells you that when I bend down to tie my shoe, I start spinning. Or I roll over in bed to the left side and I start spinning, okay? This could be a sign of this BPPV. Oftentimes, I've mentioned nystagmus already, which is uncontrolled eye movement. These individuals, once they're having a little dizzy episode, you could look at their eyes and their eyes will just be doing this uncontrollably. They don't even have a control over it, okay? And this is often associated with the vertigo. As I mentioned prior in one of the questions, if you were to put very cold water in your ear or very warm water in your ear, it will actually cause your eyes to do the same thing because it's triggering your balance system like, whoa, something's going on here. It's not right. And we know that this BPPV, it's actually caused by these little debris crystals here that are actually in one of your balance organs here, okay? So this is like the picture I showed you before, and you can see that there's 3 canals. So in one of them, depending on which way you turn, if you have any floating debris, you may get that sensation of dizziness, okay? The good thing is this can be treated and we can realign these crystals. Typically it's done in an office with a couple of different procedures that we can get these crystals to temporarily settle back down where they need to be, okay? It's not a permanent fix because it will come back, but it is something that you guys should be. It's the most common reason why some people are dizzy. So cardiovascular disease, okay? So heart disease. They say that the ear is the window to the heart, okay? And there's a lot of research being done in this area because blood flow and good circulation, it's important in maintaining good hearing health. And the research is suggesting that if you have too little blood flow or damage to blood vessels in your inner ear, it can contribute to hearing loss. In fact, the sensitivity of the ear, research is suggesting that it's so sensitive that you may be able to see or potentially predict if somebody's going to have cardiovascular disease, maybe down the road, because of a particular pattern based on their hearing test. Okay? So I'll talk about the low frequencies and high frequencies, but typically the way that the snail is shaped, the higher pitches are actually down the bottom at the base, and the lower pitches are up the top. Typically, and most commonly, you have a high frequency hearing loss. That's at the base. Why do you have a low frequency hearing loss? That means there could be potential issues with blood flow because it's complete opposite. The lows don't go typically until later. I'll talk about that in a few slides. This is a big one, and me and Dr. Ram were talking about this yesterday. There's so much research going on in the world now about hearing loss and how it's related to your overall mental health, cognitive decline, okay? There are studies that have proven and shown that there's a connection between hearing loss, brain function decline, and your loss of brain tissue, okay? We know that the brain does naturally get a little bit smaller with age, but this happens so much quicker in adults with hearing loss, okay? I'm sure you guys have all heard of the saying, if you don't use it, you lose it, okay? And this is something that we believe is going to become very common in the industry, and there's so much research currently happening in this area. The good news is, and this was a big study out of the UK, this study found that we can slow down the reduction in rate of cognitive decline with hearing aids. This means if we can give you some auditory stimulation, we can help preserve the brain's ability to stay nice and healthy. So good hearing, we know it's going to be critical for good cognitive health overall. Let me just see if there's any questions here. No questions yet, okay? Diabetes. Diabetes is so common. You could almost think of it as a, it's a little pandemic in itself. There's so many people that have diabetes. Whether it's type 1 or type 2, there's a problem with the insulin levels, okay? And again, it's a theory that suggests that high blood sugar can cause damage to these small blood vessels in the ear. And studies are showing that if you have diabetes, you're at 2 times more risk to have a hearing loss in comparison to somebody who doesn't have diabetes, okay? Now you can see it's changing here. With the cardiovascular disease, it's a low frequency hearing loss, and I'll talk about what that is. But with diabetes, there's a correlation between high frequency hearing loss and diabetes. Ear infections. This was brought up in the earlier questions. It's the most common form of ear pain, especially in children. Common symptoms in children include they're going to be tugging at their ear, okay? They may sleep very poor, they may have some active drainage, and they might not want to eat, okay? With children, the shape of their ear, it's actually much straighter than an adult. So our ear actually, believe it or not, you take your finger and put it in your ear, you hit a piece of bone. It doesn't go too far because your ear actually goes towards your nose first and then it comes back towards the back of your head. So it's kind of like an S shape. in babies and children, it hasn't grown. The ear canal hasn't changed shape yet. So I've heard that babies that drink milk while they're laying on their back all the time, they could have a higher risk of having an ear infection because the milk can actually go up in their eustachian tube and then it gets in their middle ear. And then they could have an ear infection. So if you can have babies, feed the baby sitting up. That should help if they are prone to ear infections. Common symptoms in adults: earache, feeling of fullness, diminished hearing, and drainage. Diminished hearing because when I showed you the picture of the outer ear, middle ear, in that area, when you have an ear infection, that area is filled with fluid. Sound can't get in, and now you have a mild to moderate hearing loss in one ear or the other ear. This happens often too when you get a cold. When you get a sinus cold or a head cold, you feel like, geez, you're all plugged up and you can't hear. That's because there's probably some fluid behind your ear, okay? And you can see here, it's often caused by cold and flu viruses, bacteria, fungus, or yeast. Something's getting in there and it's not clearing itself. There's different types of infections. Inner ear infections, these normally affect children. As I mentioned, they have smaller eustachian tubes and they can't clear it on their own. In outer ear, these normally affect adults, and they're common in people who suffer from skin problems such as eczema, psoriasis, or dermatitis, okay? With ear infections, most of them will clear up on their own. Some will clear up in a few days. Some take, weeks. Others take months. There's no magic. There's no magic number as to how long or how fast they'll cure up. They'll resolve themselves. But if you have prolonged infections, you may require antibiotics from your doctor or tubes, okay? Tubes would be for chronic ear infections, and these are often in babies where they go in for a little day procedure. They actually put a little tube in the ear, and that tube is designed to keep the pressure between the middle ear and outer ear normal, as well as it allows the fluid to drain out of their ear. These tubes will fall out on their own, and the ear drum itself, it actually will repair itself and heal itself on its own. Okay? So earwax, I just put this in here as general information. So earwax can be brown, orange, red, yellowish, dark brown. When it starts to get that black color, it's really old, okay? And it's produced in the ear canal, as I showed earlier. And it's really a protective mechanism. It's designed to protect the skin of the ear canal. For example, if let's say an ant were to crawl up your face and go in your ear, sounds pretty gross. If you have some earwax in there, guess what? He's going to get stuck. There are, some very poor countries out there, and there's a lot of bugs and stuff that can actually do some damage. So earwax is actually a good thing. It's not good to have super clear ears all the time. As I mentioned, the ear is self-clearing, so normally earwax will work its way out automatically, okay? But sometimes it can block your ears. Never use your fingers or cotton buds or Q-tips. This just pushes everything back in your ear canal. Makes it harder to get out. The ear naturally wants to work the wax out, but by using a Q-tip, you're actually pushing it further in. Then it's changing color because we'll say new earwax is like a brown, orangey color, yellowish. Once it gets old, it's dark brown or black, and it's very hard to move. Some people will actually have complete blockages from wax in their ears. And if you were to go to the doctors or see an audiologist, they'll tell you, put a couple drops of oil in your ear. It's going to soften the wax up for a few days. And then over the next little while, you should start to see the wax actually fall out of your ear. If this doesn't work, then you would actually go see some family physicians will actually remove wax. I know it's becoming less and less. And they're actually referring to audiologists who will then use a vacuum suction to remove the wax from your ear. I just need to check the question box. It keeps leaving every time I change screens. Mario,
Yes, sir.
is there a way I can lock the question or the chat box on the screen?
Let me try.
Because I'm trying to lock it. It keeps, every time I go to another screen, it leaves. So I can't see it right now. But I'd like to lock it there so I can see it.
All right. I don't know if we can do that, but no one asked a question. There's a question from Warren Kelsey. Are there higher rates of hearing loss in people of African descent?
You know what? It's pretty standard across the board. It really depends on a number of things. You know, lifestyle is one of them. You know, I can't really speak on the genetic side of things, but lifestyle, so your occupation, what some of your hobbies are, genetic components, you know, if you have a family history of it, yeah, you're probably at more risk, but I would say it's pretty standard across the board.
Does Audiologist work to ban Q-tip?
Ban Q-tips. No, we don't ban Q-tips, but we're against them because we know they can actually just do more damage. If you puncture your eardrum, you'll probably rush to the hospital, but nobody will be able to do anything because you need to actually get a surgery then. They'll need to repair your eardrum, and you'll have a moderate hearing loss if you puncture your eardrum. So me talking at this level, you would have difficulty hearing me if your eardrum was punctured.
I am a member of a large percussion group, about 25 in total, and I also DJ from time to time, and my speakers are always on my ear level behind the DJ booth. Is there anything I can do to prevent hearing damage, if any?
Absolutely. So I'm a DJ myself too, as a hobby. What you would need, you need musicians plugs. So they're custom earplugs that are made for you that are going to filter down all of that percussion, okay? You'll still hear everything, but instead of it being at, 100%, you'll hear it at 70%. So these are custom musician plugs with a filter that will still allow you to hear your percussion group. Cost? The cost will vary. I work for the manufacturer, so I supply it to the business owner. Whatever the business owner has as a markup, that's on them. I don't determine that.
Can I ask a question?
Sure.
So this is a question, but also a statement. So about 9 years ago, there was a lot of stress in my life. And over a span of 2 or 3 days, I started losing my hearing. And I had that vertigo feeling. And I don't know what was going on. I am diabetic, and that was the most major thing in my life. And I went to the ENT doctor because I do have an ENT doctor,
Yep.
And they did an ear test and come to find out that I had lost 40%, I only had 40% left of my hearing. So what they did in an emergency was they put tubes in my ears because they thought by putting the tubes in my ears, it was the best way to deliver, because of my conditions, it was the best way to deliver the steroid that they wanted to give me to see if they could get my hearing back. I was really scared about it because I know what babies go through. They go through a day surgery. Well, they did it right while I was awake, the whole surgery, and putting the tubes in my ears, which I would never, ever do again, and never tell anyone that it's a good thing. I'll never do it again. But I had lost that much hearing. It lasted 10 days, and each day I had to go in and get delivered through a syringe which they put in both of my ears, a certain amount of
Prednisone.
the
Prednisone.
yes, prednisone.
And it's,
For 10 days.
and
And
it's,
then I finally slowly got it back. I never completely got my hearing 100% back, but it got back. So I asked them, why did this happen? They did a whole bunch of series of CT scans, MRIs. They never did find out why it happened. They just chalked it up to calling it profound hearing loss. That's why I asked that question. So why did that happen to me? And was it safe for them to do that kind of a surgery, to put tubes in my ears? Like
yeah.
that?
So I have a whole slide on exactly what you're talking about, which is a sudden sensory neural hearing loss. Okay.
Uh-huh.
And most times, the word that the doctors may have used is idiopathic. Nobody knows why it happens, but believe it or not, it happens probably, I'm going to say 15 to 20 times a year, whereby somebody could be sleeping, they wake up, hearing is gone. No rhyme or reason why. And the reason why they put the tube in your eardrum is because, you know how I showed like the outer ear, the middle, and the inner? It's the cochlea. So the fastest way to get that steroid to your cochlea is for them to inject it through that tube right to your inner ear. It's the best possible way because you only have a 24 to 48 hour window to get that prednisone. If you didn't get that, you probably wouldn't have any hearing right now. So that's it's very hard facts, but exactly what they did, it's the right approach. If you would have went to the emergency, you may have not even got any prednisone, and you may be in a different scenario than what you are currently. So the tubes and doing it in the office, they had to do that. They probably just froze your ear and did it very quickly. They actually do it for kids now in their ENT little cubicle. They don't even put them under for surgery. They do it right there because that's how many people need tubes in their ears. So great question. And they did exactly what we would recommend working with them, what they would do. My challenge and my hope is after this presentation, did you have a hearing test before this happened?
Yeah.
So then you've had a baseline, you know where things are,
Mm-hmm.
or all of a sudden you lost it.
Mm-hmm.
If you didn't, then we would have no idea how much recovery we have because you didn't have basically that picture or the audiogram. So it's a great question. And that's the right approach. They definitely did the right thing.
Okay.
Yep.
Okay. Thank you.
You're very welcome.
There's next question, Doc. What is the physiology behind genetic deafness?
Very complex. I'm not a geneticist at all, but there are certain genes, for example, like connexin 26. If you want to Google that, you can. It's a gene on the 26th chromosome, and it actually accounts for 20% of all childhood hearing loss. You can actually get screened for it while the baby's in utero to see if your baby has a hearing loss. But the genetic component, I mean, I can't really speak on exactly what happens. Besides, there's different genes. There's certain syndromes, Down syndrome, Usher's syndrome. There's all kinds of other conditions that are associated with hearing loss. And a little fact is the kidney, it's developed at the same time as the ear when the baby's in the womb. Okay, so oftentimes if somebody has a kidney issue, it could be that they have a hearing loss or hearing concerns as well because they're developed at the same time. Okay, so it's very complex on the genetic side, but there's certain conditions that will put you more at risk, but I don't know the exact stats. All right, so thanks, Mario. Maybe you can keep reading the questions because then when I click here, the questions go away. So maybe you can, I see that that's the last one. I'm going to carry on.
Not a problem.
Thank you, sir. So falls and balance, okay? So as I mentioned, our balance organ is actually in the ear as well. The stats are pretty astounding for seniors over the age of 65. So 33% of them will fall each year, okay? And falls, unfortunately, they're the leading cause of death among people that are 65 and older, okay? When a person has a fall, you know, oftentimes it just strips their independence away from them. And a stat that I don't have here is if somebody has had a fall, 50% of people that have had a fall and ended up in hospital, within 2 years, they typically pass away. It's pretty scary, a fall. But where are falls and where's the balance organ? It's in the ear. And those with a mild hearing loss are 3 times more likely to have a history of falling than somebody with normal hearing. And as your hearing progresses, your risk increases 1.4 times for every 10 decibels of additional hearing loss. So that means somebody that has a severe to profound hearing loss, your risk of falling is, you know, 5 times greater than somebody that has normal hearing. And we believe it's because, you know, the world around you is much quieter now, and you're just not fully aware of where everything is, and that can attribute to you falling. Okay, so if you feel that you do have a balance issue, you know what they're going to do? They're going to send you for a hearing test. We need to make sure that there's nothing going on with the hearing side before they put you for a whole series of balance testing. Okay. Ototoxicity. It's a big word, but oto is ear and toxicity is poisoning. Okay. So this is ear poisoning that results from exposure to many drugs or chemicals that damage your inner ear that can impact the hearing and or balance nerve. It can cause a mix of either hearing loss and or balance problems. And currently there's more than 200 known medications, some prescription and over-the-counter, on the market today. I'm sure you guys have all heard of aspirin, Tylenol, Advil. There's a lot of chemotherapy drugs out there. They can cause sometimes permanent hearing loss, or sometimes it's reversible. For example, with aspirin, I've seen some patients, for some reason they were taking between 8 to 12 aspirin a day. Their ears were ringing like a freight train, and they had a temporary hearing loss. That was reversed once they stopped taking the aspirin. Unfortunately, when you're thinking of a cancer patient, somebody that needs chemo, it's life or death. I need the chemo. The hearing's really not top of mind. But for anybody going through chemo, it's recommended they get a baseline hearing test before they start chemo, and then they get a follow-up after they're done the chemo drugs, because these chemo medications will actually cause damage, permanent damage to your hearing. Okay? So here you go. Here's the slide on the sudden sensory neural hearing loss. This is a hearing medical emergency. It's a sudden deafness, and it happens sometimes all at once, or it happens over a few days. Most times it happens when people wake up in the morning, and typically it affects one ear, okay? Some people just think, oh, yeah, it'll come back on its own. Yeah, I'm not sure. Maybe I wasn't feeling so well last night. Take a couple ibuprofen or Tylenol and think it will resolve itself. No, okay? As I already mentioned, you need to get that prednisone, which would be prescribed by the ENT within 24 to 48 hours, and that greatly increases the chance that you will recover some of your hearing. There's no guarantee on how much you'll get back. Some people, none of it come back. Others, it ranges between 20 and 80%, okay? So I don't know your name, but I think getting 40%, I think you did okay. Yeah.
Question?
Yeah, go ahead.
Does hearing loss start at the age of 10?
Hearing loss does not discriminate when it comes to age. You could be born with hearing loss. You could develop a hearing loss from a a firecracker going off when you're 4 years old. Doesn't matter.
Is ringing in the air something we should be concerned about?
Oh, what a great segue. Look, there you go. Tinnitus or tinnitus. This is that ringing in the ears. To be concerned about it, it's not a medical condition in itself. It's typically a symptom of something, okay? So tinnitus is this phantom auditory perception. So only you, the individual, hears the ringing. It's estimated that more than 43% of Canadians have some type of tinnitus. And it's a ringing, a buzzing, a hissing, static sounds that people hear in the ear. It's most commonly caused by noise exposure, okay? Exposure to loud noise time and time again without hearing protection will actually cause tinnitus. And I can even provide another example here. How many of us have been to a live concert or a band or a club? I'll raise my hand, no hearing protection. What happens when you leave the club and you get home? Do you notice that your ears were ringing when you lay down to go to sleep? Oftentimes your ears they're ringing. It's because they're oversensitized and you have some temporary tinnitus. The people that keep going back to the club and back to the concert time and time again without giving themselves some time to get back to normal, these are the people that are causing permanent damage to their hearing. So hearing loss, head and neck injury, tinnitus. Some people do not have tinnitus. They get in a car accident and they have whiplash. All of a sudden, their ears are ringing. Okay, so this is like a cervical type tinnitus. Chronic diseases, as I've already mentioned, and medications. And the severity can range from mild to severe. So the thing with tinnitus, it's not the tinnitus itself that is harmful. What it is, it's the person's negative emotional response to it. And tinnitus, people perceive it as changing throughout the day. Well, most times their tinnitus is at the same level, okay? But what's changing throughout the day is the amount of background noise that they're in. They're at home. Maybe they just wake up, it's very quiet. Their tinnitus is louder than their environment. As they go to work and, they're outside in their car, don't hear the tinnitus. It's not even bothersome because there's so much noise in the world, they don't hear their tinnitus until they come home at night, get ready to lay down and go to bed. What happens? Their ears are ringing. Why? Because the world around them is very quiet. So the goal when it comes to treatment of tinnitus, we got to educate you on what type of tinnitus you have and try to remove your negative response that you're having to it because it's very cyclical. Tinnitus causes stress, stress causes lack of sleep, and then you're in this triangle and it's like you're on a hamster wheel. So we need to get you out of that cycle. There's no cure for it, but tinnitus is very manageable. There's apps that you could download. For example, my company has a free app called Starkey Relax. You can download it, put it on your iPhone, your tablet, put it on the bedside so that there's some bedtime noise so that you don't pay attention or don't hear the ringing. Then you go to sleep and everything's okay. So it's all about managing the tinnitus. I would encourage you, if you do have tinnitus, please get a hearing test because there could be some damage to your hearing system.
I got two more questions, Doc. Hold on. Why do certain sounds seem to bother me more than other people? Example, people chewing, background noise.
Okay, so there's a couple different things that I won't be touching on, but people chewing, it's that sound, like that crunching sound. It's actually like an auditory type of hallucination, like people don't like it. I've only heard of it very few times, but a person chewing, people can't stand that sound. It's an emotional response that they have to that sound, very similar to the tinnitus. It's almost like they're super sensitive to the chewing sound because of something that's going on perhaps within their environment. I don't know for sure, but get a hearing test. Maybe there's a super sensitive area, and you'll see on my audiogram when I come to it that there's a bone line and then there's an air line, and it'll make a little more sense. But we hear two ways. We hear naturally through our ear, but we also hear directly through bone without going to our ear. In hearing in background noise, background noise, that's the number one red flag for the potential that there could be hearing loss there. Okay, so I'll talk quite a bit on that in a few slides.
Last question. Does drug or alcohol use cause any kind of permanent hearing loss?
I can't really say for sure. Drug, I don't know what's meant. That's a big category there. So I'm not going to comment on the drug or alcohol really, but I would say, do everything in moderation. I'm not an expert. I don't know if, drinking too much gin will cause hearing loss. Like there's not a lot of research out there on stuff like that. All right, so some great questions. And now I'm going to switch a little bit and talk about loudness levels. So sound is measured in decibels. And yesterday when I was talking to Mario on the Zoom chat, he was like, yeah, when I was in the Bahamas, I had my big 12-inch subwoofers. Yep, I'm sure they were rattling the whole trunk of the car and potentially probably causing some hearing loss that could be there now. So you're first on my list, my friend. But we measure sound in decibels, and damage can occur at different levels, but it's really dependent upon the time of exposure. So now I'm going to just show you some common things that we see and do daily in the potential impact it can have on your hearing. So the softest sound that can be heard, we say it's like a 0 decibel sound, okay? Breathing's about 10, a ticking watch, a whisper, a refrigerator. Normal conversation is around 60 decibels. So if somebody did puncture their eardrum, as I mentioned, that could cause a 50 decibel hearing loss. That means they would only be hearing normal conversation, softer than a whisper. The good news is, though, sounds at these levels, they typically don't cause any hearing damage. A wash machine, a dishwasher, city traffic, you may start to have an emotional reaction to this. Like it's putting some stress on your body, you can feel it, and the loudness is actually starting to bother you. Within occupational health and safety guidelines, 85 decibels here for an 8-hour workday is okay. That does not mean I do not want you to wear hearing protection. You need to protect what you have, because when it's gone, there's no getting it back. Okay? So you'll see this next slide. We all know people who use lawnmowers, leaf blowers, whippersnippers. It's around this 80 to 85 decibels, and it's not saying its damage is definitely going to occur, but damage to the hearing is possible after 2 hours of exposure. It's related to this noise-induced hearing loss. It may not be you using the lawnmower now for the next 10 years, but in 20 years from now, you'll be, what did you say? Because the system's getting damaged slowly over time until it becomes something that you can't bear. A motorcycle, very loud. Possible damage if you don't have hearing protection within 50 minutes. A car horn, sporting events, okay? These are very loud, 100 decibels. Personal listening devices. This is becoming very concerning. Somebody mentioned, does hearing loss start at 10? No, there's no age per se, but we are starting to see that the age of hearing from noise is actually getting younger. All of the headphones, all of the gaming systems, people are listening to things extremely loud, and over time that will cause damage, okay? Standing beside or near sirens, some people actually can feel pain, and you can see a firecracker. Like if you're going to light off a firecracker, put in some earplugs. Same with people that like to hunt. We know the hunters even before they tell us that they've been hunting. Because if you're a right-handed shooter, okay, this ear is typically protected, your right ear. Your left ear is wide open, taking all of the noise, okay? When you come to get a hearing test, one ear is normal and the other ear is completely gone. Normally, both ears change at the same rate because they're together. So, pay attention to what you're doing in the environment. When I first moved into my house a few years ago, started cutting the lawn, youngest guy probably wearing hearing protection. All the neighbors have caught on because they asked me, why are you doing that? Well, I want to protect what I have. You only get one shot at it, and if not, then it's, a hearing aid or something else, such as a cochlear implant to try to help you along. Any questions, Mario?
No, sir.
Okay. So some signs of hearing loss. Number one would be difficulty hearing in a crowd or background noise. People always think that have a hearing loss, oh, Mario, you're mumbling or you're talking too fast. Mario's probably talking at a normal rate, but it's the perception and the hearing of the person with the hearing loss. They perceive that person mumbling, or if I cover my mouth, it sounds like this. People are not getting it, okay? So if I talk like this, it's very difficult. Archie, I see you copying me. Turning up the TV or radio louder than usual. This is a classic example of my mom. I've been in the profession about 7 years. Walk into my mom's place, the TV's on 60. It can only go to 65. Oh, it's not loud? Turn the TV down, Mom. Had to send her somewhere else to get a hearing test. Yeah, she has a hearing loss. But the TV's one thing. Because you'll see in a few slides, people are turning the TV up because the TV's not clear. So they want more clarity, which is like treble on a stereo. But when you turn the TV up, you're increasing overall volume, not just the treble, okay? Speaking louder than necessary. I have a few brothers in this category. They talk really loud, and I'm like, you should go get a hearing test. This is how we, the auditory loop for ourselves. This is how we understand and make sure that we're saying what we should. An example would be if I'm on a phone and I'm in a restaurant, I might be screaming at you, Archie. Archie, can you hear me? It's because I want to hear myself. And Archie's like, man, lower your voice. I don't want to hear you that loud, right? Sorry if I'm picking on you, Archie. I can see your face, and it's the only one I can see, so. Constantly asking for others to repeat words. Okay, this is another red flag. Difficulty hearing on the telephone. It's not the phone. It's not the volume. More than likely, it's your ability to understand, okay? People are not aware that the phone, it actually cuts off at a certain frequency. So if you don't have good hearing for all of those frequencies, a lot of things will sound the same. People that are starting to identify with the hearing loss as well, they're going to avoid some social gatherings. They're going to start socially isolating themselves because they don't want to be a part of it because it's embarrassing to them now. No, sorry, I have something else to do tonight. No, I'm not available this weekend. They'll just start making some excuses because they know being in that situation is very difficult for them to enjoy. Reading people's lips instead of making eye contact. This is a big sign because lip reading, so many people do it unconsciously, and there's so many sounds that that look the same. So like a B and a P, they look very similar, but if I cover my mouth, you don't get to see what I'm actually saying. And the last point I have here, and there's many more, but these ones are the most highest priority. Difficulty understanding women and children, okay? It doesn't mean that there will not be difficulty understanding men, but women and children, they have higher pitched voices. And as I mentioned before, typically it's the higher pitched, higher frequencies that go first when it comes to hearing loss, okay? So women and children, they're typically the hardest to understand with a hearing loss.
I got 3 questions for you, Doc.
Sure.
What can someone suffering from hearing loss can do to maximize their hearing?
First, they got to get a hearing test because we need to know how severe it is. And then from the result of the hearing test, the audiologist would make a recommendation. 90% of hearing loss can be treated with amplification or a hearing aid.
Okay.
Okay.
What techniques can compensate for hearing, and how can someone get these skills if there is any?
So I could have put that up here, you know, favoring one ear. Maybe I'll sit on the left side all the time because I know that, you know, the right side's my better ear. Perhaps there's a hearing loss there. But there are some environmental things you can do. For example, if you have a favorite restaurant, nobody's going to any right now, unfortunately with the pandemic, but if you have a favorite restaurant, when you go there, most people will actually find a spot and put their back to the wall. That's the wrong approach. You actually want to put your back to the noise because your ears point forward for a reason, so that they can pay attention to the words coming from the front, right? This would be the same if somebody has a hearing loss. Don't sit with your hearing aids on with the wall behind you. That's not doing anything. You want to turn around and put your back to the noise so the hearing aids can actually reduce some of that background noise. The other thing to think of is the time that you're going. You may want to go at supper time when it's very popular and busy. That's when it's going to be the loudest as well. So go when it's not so busy. And then you can also ask the restaurant, they have music playing. Can you please turn the music down? We need to advocate for ourselves if we have a hearing loss or we're struggling, because nobody's going to do that for us. Any more questions?
This last question, it says, can friends and family help a person suffering from hearing loss? Is hearing loss genetic?
So friends and family, I mean, yes, you can definitely help. It would be more on the emotional side, you know, helping support them. To be honest, when somebody starts to lose their hearing, it's not something most people admit to. As I mentioned, it's like a sense of embarrassment. You know, it's vanity. I can't tell anybody about this. Like, I'm going to feel like I'm old. As I mentioned, hearing loss doesn't discriminate when it comes to age. And in fact, with the research on the cognitive decline, the sooner that you do something, the better it is for your overall health, because we can actually get you the stimulation that you need. So can the family or friends do something themselves? Not necessarily, but maybe support you, because we're going to go through phases. They're going to be in denial, then they're going to accept it. Okay, then they're going to go through their hearing journey. And what we see right now, from the time somebody knows that they have a hearing loss, it takes on average 7 years before they go in and seek help. 7 years. 7 years of their life that they've been bluffing and missing information and not being engaged in the conversation. We need them to go sooner so that they can be engaged and stay informed on what's happening. And when you think about it right now, this pandemic, I'm getting so many calls from customers and people saying there's people that are at home and they're realizing right now that their hearing is more important than ever, because they need to be connected to their loved ones, stay engaged about what's on the news, as well as just know what's happening and what's going on. Okay, so anything else?
Yeah. Is it genetic?
There's genetic components. I mean, there are genetic studies out there. For example, there's a big study in Newfoundland whereby there's specific families, and their families have genetic hearing loss going back, 7 or 8 generations. So if you feel like you have a genetic component, yeah, it's a possibility. There's no like magic bullet unless you were to get a genetic hearing test to see if you have a specific gene that codes for hearing loss. And most people don't, because it's pretty expensive unless you get involved in a research study and somebody will do that voluntarily.
That's it for questions for now.
Okay. So how to protect your hearing. This has come up already. Use hearing protection, whether it's the foam earplugs or custom earplugs. You may not even be aware that you can go get a set of earplugs that are custom made for your ears. I have a set right here. Okay. So see this? This is a little custom hearing protection. I pop that in my ear. It fits my ear only, nobody else's ear. So it will provide the best ability to keep sounds out that I don't want to hear. I'm not saying foam earplugs aren't good. The problem with foam earplugs is most people don't know how to insert them. So I'm going to show you how to do that. Avoid exposure to loud sounds. It's kind of common sense, okay? Limit the time that you're exposed to these loud sounds. Turn the volume down. If you love that one favorite song and you're listening to it through your earphones or in the car, turn your one song up, listen to it, have a good time, and then turn it back down to a comfortable level. Give your ears time to recover, okay? So oftentimes, and this happens with the younger generation, like they do like to, have their social gatherings and go out. You go out too many times in a row, you're hearing the thresholds gradually change, and it's a permanent change. I've already talked about do not put anything in your ear smaller than your elbow. It's kind of the running joke in audiology, but we don't want you to be putting anything in your ear. And get your hearing tested. So how to use foam earplugs, okay? What you need to do, get them, roll them up as small as you can so that they're very, very small in your hand. The trick is, take your other hand, pull your ear back and up. This straightens out your ear canal. And jam the little foam plug in as far as you can. Don't worry, it's not going to hit your eardrum. Your eardrum's not that close. And then hold it there until it starts to expand. This will give you the best chance to have protection with foam earplugs.
Doc, I got 2 questions for you.
Sure.
When do you recommend the use of these customized earplug?
It depends. Some people, like musicians, you could have people that are factory workers. You could have people that do construction work. You can get custom earplugs for whatever situation you want. The good thing about them is they're designed for your ear and they fit specific. There's also sleep plugs. There's swim plugs. There's plugs that are designed with filters if you want to have a conversation while blocking out noise. There's many different examples, but I would say if you're concerned that you're exposed to too much noise, put the hearing protection in. It's the best thing that you can do to protect your hearing.
Where could these plugs be purchased?
These plugs can be purchased at any private hearing clinic.
So this is a question for me. I mean, we talked about this. Do individuals have to be prescribed by a doctor or be referred by a doctor to see a specialist?
No, you do not. And most people are not aware of that. It's an open referral policy for a hearing test. You can pick up the phone tomorrow morning, call a public or private hearing clinic, and refer yourself. They'll say, what's your name? Why are you calling? Can I have your address, phone number, get those details? And you just say, hey, I want to have a baseline hearing test. Or maybe I have some ringing in my ear. So you can self-refer yourself. You do not need a referral from a doctor.
Do we pay for this? Do insurance pay for this, or this is a free thing?
So there's 2 different routes, and I do have it on one of my slides, but you can, if you go publicly, which is Nova Scotia Hearing and Speech, this is covered by your MSI, it's covered by your health card. There will be a little bit longer of a wait list. Or you can go privately, and if you go privately, it will cost, I don't know the price, it really depends on the clinic, but you can get in quicker, okay? the good news is there's a lot of insurance companies out there, you know, Blue Cross or Sun Life or Desjardins or whatever. They'll actually cover the cost of hearing tests as well. So it's built into a lot of healthcare policies.
That's it for the questions.
Okay, perfect. All right, so here's my challenge to you. If you haven't done it already, everyone go out and get a baseline hearing assessment. It's only going to take about an hour of your time, and then at least you'll have a picture. The baseline, I'll walk through what the steps are of the assessment, but at least now we'll know where you stand in case something happens. The biggest concern we have is if we don't have something documented, how do we know how bad it was in comparison to what it is now? People go get their eyes tested every 2 years. No problem. Get your glasses, you're good to go. Ears are just waiting. Things are slowly getting quieter and you're not even noticing, okay? So everyone go get a baseline assessment. It's an open referral policy. Mario, this was a great segue. It's like you knew the presentation. Private or public, okay? And most health insurances will cover it. And as well, some will cover a portion of hearing aids if necessary. So what can you expect to be done at a hearing assessment, okay? It's the most simple, non-invasive. It will not hurt you. It's pretty easy. It's actually pretty cool to see a lot of the instruments, but I'll walk through what you can expect at a hearing assessment. First and most important is the case history. You know, have you had a history of ear surgery? Are you on any medications? Do you have a family history of hearing loss? Do you have ringing in your ears? We'll ask all these questions to kind of put together the puzzle of who are we dealing with. Then we'll go to otoscopy. I'll talk about that. These are big fancy words, but otoscopy, this is tympanometry, looking in your ears. You know, pure tone testing and speech testing. This is where the bread and butter happens. And then we have results. And then it's either, you know, we refer you on to see to your GP, which then would refer you to ENT if you have something that we feel needs extra attention. Or are you a candidate for amplification or a hearing aid based on no other contraindications for you to be fit with a hearing aid. So, not to gross you guys out, but this is what the eardrum looks like. It's pretty neat, okay? So, otoscopy, that's when the doctor gets the light. They look in your ear. This is a normal, healthy eardrum. You can see, here's your eardrum. Here's the bones that I was talking about that are in your middle ear, okay? This one here, not looking so nice. You can see there's some amber-like fluid behind their ear. This person has an active ear infection. And then you can see down here in this other picture, this person has a hole in their eardrum. We can see this pretty clear when we look in with the light. So we're looking for the color, the position of the eardrum. We want to make sure everything looks good so we can proceed with our test. If I were to look in and you had a nice big clump of wax, you would see that it'd be looking right at you, okay? And it would show up as one of the colors I described earlier. So this is a very important test. After we look in your ears, then we're just going to put a little bit of air into your ear and actually move your eardrum. It's like a pressure test. You don't need to do anything, just sit there. The machine's going to check to see how your eardrum moves. Okay? Once we assess this, then we know what type of pattern can we look for in the audiogram. If both of the otoscopy and this test were normal, then we know, okay, this person probably has pretty good hearing. Then we're going to check out the tones in the speech testing, okay? This is just very quick. But I mentioned earlier that we can test the system two ways. One is through your outer ear, middle ear, inner ear. That's the normal pathway. Or we have a little special headphone that we put just back here on your mastoid bone. It's a very spongy bone, and we can test your hearing through there, and it actually just goes right to your cochlea. What's important is your speech reception and your word recognition scores. So your speech receptions, these are the softest words that you can hear and repeat back at least 50% of the time. And then your word recognition score. So I'm going to make it so that it's at a nice comfortable level for you. And I'm going to play some words. And I want you to repeat the words back to me. Okay? And then I'm going to give you a score between 0 and 100%. So this is part of the test, and this is part of our word recognition. And together, we plotted on a nice chart, and this is what an audiogram could look like. So this is the person's right ear, and this is the person's left ear. Here are those bass sounds. This is male voices. Male voices are lower pitched, they're down here. Female voices are up here and all the softer consonants. If somebody has a mild hearing loss, their hearing is between 25 and 50 decibels. So this person actually has a mild high frequency hearing loss. You can see things start to dip down here in the higher pitches. This person has difficulty hearing in background noise. But when we make things loud enough for them, you can see that they understand things 100% of the time. That's great. That means they're a perfect hearing aid candidate. You put a hearing aid on this person, they're going to go into the real world and do just fine. Okay? The concern is a profound hearing loss is actually down here. Like, we need to make things 100 to 110 decibels of loudness before you even hear it without a hearing aid on. So you would literally need to come up to that person, if they didn't have a hearing device on, and scream at them. And they may only get bits and pieces of it. But what's important with the profound hearing loss, maybe their word understanding is, 20, 30% as well. So that means even in the best case scenario, they only understand things 20 to 30% of the time. Okay? So that's kind of our puzzle, and then we'd make a recommendation for you based on the results of your hearing test.
I have a question. One question is, can you do the test yourself?
No, you need to actually be in a soundproof booth, okay? So you need to go to the clinic. They're going to put you in a booth. There are apps where you can do a screener, but it's not going to do a full test like this. And I have an app, and I can share it with you, Mario or Dwayne, and you can share it with the team. It'll ask you to go into a quiet room, put in a set of earphones, and listen for the beeps. Okay? It's not going to be as accurate as this because of calibration, and this is actually done in a quiet, soundproof booth where there's no other interference. Any more questions?
No, that's it for the questions right now.
Okay. All right, so that brings me to the end. Hearing protection really is the only way to maintain good hearing health. You need to protect it now so that it's there for you later on. No different than your teeth. If you don't brush your teeth, they're all going to fall out. You get some dentures, you don't take care of those, and then you won't have teeth and you won't be able to enjoy that nice piece of steak. Hearing's, for me, much more important. Music, the kids, conversations with others, that's how we stay connected. You need to protect it now so that it's there later on in life. There's several chronic health conditions that are associated with hearing loss. I only touched on a few. I could do a whole presentation on hearing and how it's connected to so many other things. Most hearing loss is permanent, okay? And if left untreated, it will definitely impact your quality of life. 90% of hearing losses can be treated with the use of hearing instruments. The sooner that you do something, the better off you'll be, okay? And it will take just 1 hour of your time to get that baseline picture of your hearing. If you go and everything is normal, they'll say, based on your age, maybe come back every 2 years, maybe come back every 5 years. But nobody knows until you go and get that initial hearing test. So that's all I have in my presentation.